About 15 years ago, I became a patient at HealthyKids. I was in middle school. I had struggled my whole life already with my weight. Even though out of my sisters, I actually was the healthiest eater. So it was very frustrating and didn't really make a lot of sense. So after doing many different diets as a kid, and nothing would really work long term, my mom had heard about HealthyKids and signed me up. So I will go to HealthyKids, and it's completely a different approach than any of the other diets or diet books or anything I had ever tried before. So I actually did HealthyKids for just about 8 weeks. They did an 8-week group program with Dr. Jeffrey, a dietitian, and a nurse. And through those 8 weeks, we worked a lot on learning a plan that they use called the stoplight plan, which categorizes foods into different lists, helps you learn, especially as an insulin resistant kid, what foods your body needs more of, what foods don't really make any positive impact on your body. My BMI had gone down, my triglycerides had gone down, my cholesterol had gone down. So after the 8 weeks, we would just do monthly or every 2-month checkups with Dr. Jeffrey and the dietitian to kind of just stay on track, keep things rolling. Nutrition was interesting to me. It was fascinating how different foods affect our bodies. So at 16, I decided I'm going to become a dietitian. I want to do what HealthyKids did for me. I want to help other kids, and I understand how they felt because I was one of them. So I decided at that age that I wanted to be a dietitian. And I even told people that my dream job was to work at HealthyKids. So I think I have a unique perspective with our HealthyKids patients because I literally was one of them before, and I know how it feels. And many of our patients have insulin resistance or prediabetes, which were the same things that I dealt with as a kid. So I do believe I have that unique viewpoint of where I know how they feel, I know where they're coming from, I understand the frustrations they might be going through, and it's really supportive for the children also to hear from somebody who's done the same thing and to look at how it really does help. And it's interesting to share my story with the kids when I really feel like they need some extra encouragement, because I just have that firsthand experience. And it's also very encouraging for them as well. So my advice to families, if your child is struggling with their weight or maybe prediabetes or insulin resistance, don't wait. The earlier that you start making interventions, the better off. Dr. Jeffrey and I always say we love to get the really little kids because starting earlier is always the best place to start.